You're a product manager in healthcare right now, and you're not thinking about Agentic AI, your roadmap is already behind. Because we're not just talking about the AI that answers questions or summarizes notes. We are talking about AI that acts, AI that autonomously schedules follow-ups, AI that flags deteriorating patients, it fills prior authorizations, and it coordinates care without a human being involved to click go. That is Agentic AI. Hi, I'm Jennifer Rist. I'm a senior global platform leader at a leading healthcare tech company where I manage cloud-based SaaS products. And in this video, I'm going to show you exactly how to build and to prioritize features around it so your product doesn't just keep up, but it leads. So whether you're building an EHR integration, a clinical decision support tool, a remote patient monitoring platform, or a revenue cycle management product, Agentic AI is reshaping every single one of those categories right now. By the end of this video, you'll understand what Agentic AI actually means in healthcare context, the 3-layer framework for prioritizing AI features, the most common mistakes product managers make when building healthcare AI, and which use cases are driving the most measurable value today. So let's dive in right now. So first, what is Agentic AI, and how is it different from the AI that we're already building in healthcare today? Traditional AI in healthcare is reactive. A clinician opens a chart, the AI shows a risk score, a coder submits a claim, the AI flags a denial risk. The human is still always in the driver's seat. Agentic AI is proactive. It's autonomous. It perceives its environment. It sets goals. It takes sequential actions, and it self-corrects, all with minimal or zero human intervention per step. Sounds a little scary, right? But think of it this way. A standard AI copilot, it suggests the prior authorization. An Agentic AI, it submits it. It monitors a payer response. It escalates if it's denied. And it routes the appeal, all while your staff is helping patients. In healthcare, the key Agentic AI use cases breaking through right now are autonomous prior authorization workflows, so those agents that are pulling clinical evidence, they're drafting justifications, and submitting to payers. You have patient outreach and care gap closure, agents that are maybe identifying patients overdue for screenings, overdue for appointments, sending prioritized or personalized outreach, and scheduling appointments. You also have the clinical documentation agent, so the ambient AI that not only transcribes, but it structures, it codes, it routes notes into the right EHR fields. And then you have the triage and escalation agents. These are monitoring vitals or wearable data and triggering clinical alerts or escalation pathways, all without waiting for a clinician to review. These are not science fiction. These are in production today at leading health systems. So now here's where it gets hard and where most product managers underestimate the complexity. Building Agentic AI features in healthcare isn't just a software challenge. It's a regulatory, a clinical, and an organizational challenge all at once. So it's like the perfect storm that can really set you up for destruction in a way. First, let's take a look at regulatory constraints. Healthcare AI operates under a web of oversight. You have FDA clearance for clinical decision support. You have HIPAA for data handling, and now emerging frameworks like the ONC's HTI 1 rule on algorithmic transparency. Before you put agentic action into production, your legal and compliance team, I know, you have to bring them in as a design partner these days, not as just that sign-off step in the end, and not just someone that's sitting in your cross-functional team, but an active member of your design. Now let's look at second, the trust gap. So clinicians are not defaulting to trust. They have seen too many AI tools that promise everything and deliver more alert fatigue, which they don't need, right? Your Agentic AI features need to earn trust through transparency, which is basically showing why the agent took an action with an easy human override maybe, and even looking at different aspects of the application in a way that the human can still be involved. This is sometimes called human-in-the-loop design. And in healthcare, it's not optional. It's a product strategy. And you'll hear this from so many of our customers or your customers that you work with. A lot of them, they love the thought of AI, but they don't trust it, or they don't trust it at all. So AI is here, so we can't ignore it. We need to use it and integrate it as the best that we can and in the best and right way. But we still need to prove to our customers and the users that the data and the information is valid, that they can start to trust it more. So it's going to take time to get there, but we still have to have that human factor, that human override available for many of our applications, for not only transparency so that they can get to data and information, especially if it's not coming through as designed by the AI system, but also just to keep them calm, cool, and collective, that they have control of the wheel. Third, let's look at workflow integration and workflow disruption. So the best agentic AI in healthcare fits into existing workflows. It doesn't demand clinicians to adapt to new ones. So if your agent is requiring staff to go to a new portal to, review its actions, adoption may stall. Your agent basically needs to surface maybe in the EHR. That seems to be preferable. They may have some other areas where they prefer it, and they will let you know, but you have to be flexible to be where they are and meet them where they are, wherever your users are already live and using other applications. And this is why healthcare AI products fail. Not because the modal isn't good or because your product isn't working or not trustworthy. It's because the product wasn't designed around real clinical workflow and operational workflow to meet them where they are. Okay, so how do you actually prioritize features when you're building this in space? You're trying to build some kind of agentic AI into your product. Here's the 3-layer framework that I would recommend. Layer number 1 is clinical impact and operational value. So this is really where you want to hang your hat, and it's the most important place, no matter what you're doing, AI or not. Every feature you build should map to either a clinical outcome improvement, an operational efficiency gain, or ideally both. Before anything goes on your roadmap, ask yourself, does this reduce adverse events, readmissions, or misdiagnoses? Does this save time for clinical or administrative staff? And can I quantify how much? Can I also tie this to reimbursement or cost savings metrics that matter to my buyer? So features that score high on both clinical and operational value get prioritized first. Features that are a cool AI application, but they don't move a measurable needle, they should be cut. Layer number 2 is trust and safety risk assessment. So this is where healthcare product management diverges from every other vertical. Every agentic feature must be evaluated on consequence of failure. If this agent makes a wrong call, what happens? Delayed prior authorization is recoverable. Maybe a wrong medication suggestion is not, right? So there's severity to the complexity of all of this. A second area is auditability. Can you reconstruct every action that the agent took and why in plain language? A third area is override path. So is there always a clear, frictionless way for a human to step in? So we still need that human intervention because there's not complete trust in AI, and AI hasn't proven itself to be 100% yet, right? So use this layer sequence to layer your autonomy. Start with agents that handle low consequence, high volume administrative tasks, and then build trust with the operators and the users. Then expand into higher acuity clinical workflows. Layer number 3 is integration and interoperability readiness. So that interoperability word, I can't even say it quite well because it's just too long. Agentic AI is only as powerful as the data that it can access and the systems it can act on. Before you build a feature, your team needs to answer these questions. Do we have the EHR API access or FHIR data streams that this agent needs? Might be something different, but something like that. Does this target workflow have a reliable integration point that we can write back to? And are the data quality and labeling measures good enough to trust this agent's decisions? So there's a lot to think about. Features that require 6 months of data pipeline work before the agent can function don't belong in near-term roadmap. No matter how exciting they are, prioritize features where your data foundation is solid first and your integration path is clear. So hope those tips helped. So where should you actually focus? Here are 3 use cases that are generating a lot of hype and most proven return on investment for healthcare AI products right now, even in 2025 last year. The first one is revenue cycle automation. So there's a lot going on here. I think it's a safe path. Prior authorizations, claim scrubbing, and denial management are painful, high volume, rule-based workflows, exactly where Agentic AI excels. Products in this space are seeing 30 to 50% reductions in staff time on authorizations and workflows and measurable reductions in denial rates. So if your product touches revenue cycle, this is your fastest path to measurable consumer value right now. A second area that I see that's really booming is ambient clinical documentation and autonomous coding. So the ambient documentation market is exploding, but the next frontier isn't just transcription, it's agentic coding and routing. AI that listens to a patient encounter, generates a structured SOAP note, suggests ICD-10 and CPT codes, and routes the documentation for physician review, all before the doctor leaves the room. This is a high trust, high value use case with strong physician satisfaction data so far. So this is a booming area. A third area is population health outreach agents. So care gap closure and chronic disease management require consistent personalized patient outreach at scale, which human staff can't sustain. Agentic AI that autonomously identifies care gaps, personalized outreach by maybe some communication preferences, and schedules the right appointments with the right provider is delivering measurable and improved healthcare and preventative healthcare as well. So those metrics are improving based off of using some tools that are AI generated. And here is the single biggest mistake I would say I see product managers make in healthcare AI, and it costs them time, it costs them trust, and sometimes the product itself falls apart. They build the AI feature before they solve the human workflow. But I think that happens with almost every product, whether it's AI or not, but even more so with AI involved. You can have the most accurate agentic model in the world. If the nurse doesn't know why it's flagging a patient, if the biller doesn't understand why it sent that authorization, if the physician can't see what data is used, you don't have a product. You have a liability. Before you ship an agentic feature, build the explanatory UI first. Build the audit log. Build the override. Make the agent's reasoning visible and that the human control is frictionless, that they trust it. That is what earns adoption in healthcare. That is what gets you past the CMO and the CNO review. Is something that is intuitive, something that the user understands and meets them where they are, and that they can trust because they can understand the use. Agentic AI in healthcare is not a future trend. It is present today, here and now, adding competitive advantage to all products if it's done the right way. And as a product manager, your job is to cut through the hype, identify the highest value workflows, and build with the right safeguards and ship with speed, right? So everybody wants things yesterday. And the way the technology and AI is flowing, we don't have time to wait, right? We need to move forward fast. So use the 3-layer framework. Prioritize clinical and operational impact. Build trust before you expand autonomy. And always, always, always design for the human who needs to stay in control. It needs to be designed for that clinician, that user, the person who's using it, that they understand how to use it. It meets them where they are in their workflow. If this video helped you think differently about your AI product roadmap, hit subscribe. I cover healthcare AI, product strategy, and digital health every week. And drop a comment below. So what's the biggest challenge that you're facing building AI products in healthcare right now? I read every single comment. So hit subscribe, hit the bell notification, and I will see you in the next video.